bursa. Before going to bursa, first we'll see what are this. This is the scapula bone. This is the scapula bone. This is the humerus bone. Humerus bone. So here if you see, this is the coracoid process. This is the acromial process. This is the clavicle. Okay, this is the clavicle. The joint between clavicle and acromion. This is the AC joint, acromioclavicular joint. So here these are glenohumeral joint. The red color, this is the muscle, that is the deltoid muscle, and here the muscle, it is the supraspinatus muscle, and here the green color segment, what we are saying, that is the subacromial bursa, and here blue color, what we are saying, this is the coracoacromial ligament or arch. Coracoacromial ligament or arch. So these are the structures what we are seeing here. This is the anterior view. This is the anterior view of the shoulder girdle. Okay, now we'll see bursa. If we take shoulder joint, so here we'll be having so many bursa around the shoulder joint. But most importantly, two bursas are important. First one, subacromial bursa, and one more subdeltoid bursa. If we see in our earlier classes, when we are discussing in second chapter joint structure and function, in that we discussed what is bursa, what and all the functions of the bursa we discussed already. So in this bursa, see here, subacromial, that means the bursa will be behind the acromion process, and subdeltoid, that means bursa will be beneath the deltoid. See here, the green color portion what we are seeing here, just for understanding, I am doing like this. So the green color bursa which is just behind the acromion, this is the subacromial bursa. This is the muscle, deltoid muscle. The bursa which is behind the muscle, that is the subdeltoid bursa. Even though these two bursa are separate in the location, but we will consider these two bursa as a same with one name. That name is the subacromial bursa. What is the use of this bursa? Means here you see here, the bursa is going to separate the supraspinatus tendon and head of the humerus. See here I will explain. So because of the presence of bursa, see, this is the supraspinatus tendon, this is the head of the humerus. Finally, the supraspinatus tendon will come and it will insert over the greater tuberosity. The presence of the bursa is going to separate the supraspinatus muscle tendon and head of the humerus from the structures of the coracoid process, acromion process, and coracoacromial ligament or arch, and deltoid muscle. See, this is the point. This is the main function of this abductional bursa. The bursa which is present here, which is going to separate the tendon of the supraspinatus and end of the humerus from coracoid process, acromion process, and coracoacromial ligament and deltoid muscle. So that here little protection it is going to mean, a kind of protection is provided to the supraspinatus tendon and head of the humerus by this subacromial bursa. That is the point here. And one more point, because of the presence of bursa, it is going to allow nice gliding movement, otherwise smooth gliding movement between the supraspinatus tendon and head of the humerus. Because of the presence of the bursa, it is going to allow the supraspinatus tendon will come and it will insert over the greater tuberosity. Supraspinatus tendon will come and it will insert over the greater tuberosity. So because of the presence of the bursa, the gliding arthrokinematic will happen, smooth arthrokinematic will happen between the head of the supraspinatus tendon and head of the humerus while doing abduction movement. Suppose if the bursa is not there, otherwise if the gliding is not happening smooth, that time the movement will affect, the abduction movement will affect. So here two reasons. First one, suppose one reason will take, suppose supraspinatus tendon, the muscle which is coming here, it got tear or inflammation. That time the gliding movement, arthrokinematics will not happen properly, so that there is no proper movement. One more, the bursa which is present here, because of the inflammation of the bursa, the bursa inflammation itself is going to create the inflammation to the supraspinatus tendon, because the supraspinatus tendon here, suppose if we take bursa, this is the superior line of the bursa, this is the inferior line of the bursa. The inferior line of the bursa is attached to the, it is in relation to the supraspinatus tendon. So the inflammation of the bursa, ultimately it will give inflammation to the supraspinatus tendon. So that time also here gliding movements won't happen properly. So because of the improper arthrokinematics, patient won't get the normal range of the abduction movement. So this is about the subacromial bursa. Clear?